Hello, dear students and esteemed learners. Welcome back. Welcome to my course on Sociology of Health. Now we are dealing with health expenditure and universal health coverage in this 11th week. And today we have the last lecture of this week. So, today we are having lecture number 55, and the topic is Universal Health Coverage in India, Context and Achievements. So, as you remember, we have been talking about several issues related to health expenditure and how these are connected with the larger goal of universal health coverage. We try to understand the coming into existence of universal health coverage and the conditions in which this becomes so important. Uh, we have seen that how universal health coverage are related with the sustainable development goals also, and especially goal number 3.8 basically, right? So now in this lecture we will try to understand what is happening in India in this particular context, and the concepts that I have covered in today's lecture are uh, how universal health coverage basically got became part of Indian health policies, and the high level expert group that was constituted in 2010, then the recommendations made by this group, then the kind of roadmap which was followed from 2010 to 2017, and then the national health policy of 2017, what kind of ways and means were suggested by this, and then how new programs basically came into existence in the form of Ayushman Bharat, and finally the achievements and the way forward. So all these things we'll try to understand in this lecture. So we are already aware of the basic understanding related to universal health coverage and also the issues related to health expenditure in India, right? Now we want to understand how this notion of UHA got accepted and implemented in Indian context or in India, right? So basically a high level expert group was constituted, and we will try to understand that. As suggested by World Health Organization, the Government of India constituted a high-level expert group in 2010 for suggesting the model of universal health coverage. A committee was constituted. This is how basically things happen. We are aware of about so many high-level expert groups, right? And there is one constituted for this very purpose also. And then it was basically required to suggest a model of universal health coverage for India. And this committee basically had the term of references, and there were 6 terms of references which were dealing with 4 or 5 important things like financing, then resource generation, then ensuring access to essential drugs, vaccines, and medical technology, and allowing participation of private for-profit sector in delivery of healthcare in India. So, as you may understand that there were 2 3 things which were considered as a routine kind of thing, because this committee was supposed to handle these things like financing, resource generation, and access related to drugs, vaccine, etc. But one thing, the last point is very important: allowing participation of private for-profit sector in delivery of healthcare, because a kind of shift is visible right from the 2002 health policy that we had identified earlier also, and that was a move towards increasing presence of the private sector in India's healthcare sector, right? So we had seen that because of the structural changes which took place in India in 1990s and also globally, India was already moving in the direction of privatization, and that privatization was taking place in all sectors, including the health sector. And this high level expert committee was also supposed to give suggestions on how further participation of the private for profit sector could be developed, right? So why do we say for profit? Because when we talk about the sectors like the government sector or the private sector, then within the private sector there are actually two sectors. One is not for profit and other is for profit. Not for profit is basically identified as the non-government organizations or civil society organizations or sometimes of trust, etc., right? Those are not for profit. And so the mention of the word for profit, that exclusively talks about the private sector, right? So this was basically the mandate given to the committee, and then the committee basically made recommendations. I have mentioned the recommendations here. There are a few important things that we will talk about. The main recommendations of the committee included increase public expenditure on health to at least 2.5% of GDP by the end of 12th plan and to at least 3% of the GDP by 2022. So we have been talking about basically health expenditure, and there also we were mentioning that India was spending around 1.2%, 1%, 1.1% kind of share of basically of the GDP was there, and most of the developed countries basically are having a much higher share. So it was suggested that India need to increase this in proportion to the GDP, and it suggested that 2.5% initially and then up to 3%. This is one of the very important recommendations. Then it talked about ensuring availability of free essential medicines, and then purchase of all healthcare services under the universal health coverage system should be undertaken either directly by the central and the state government through their Department of Health or by quasi-governmental autonomous agencies, right? Basically, when we are trying to take support or help or purchase the services from the private sector, then which agency basically should play a role in that? And it was suggested that the government should directly handle these things. All government funded insurance scheme should over time be integrated with the universal health coverage system. And then there are different types of insurance schemes. Basically, sometimes these are the state sponsored, and even the state sponsored health insurance schemes operate under different types of mechanism, right? So all these basically were supposed to be integrated with the universal health coverage system. So there were administrative suggestions as well as financial. Then these were some of the other recommendations, but we have already discussed the important ones. One important recommendation here is establishment of National Health Regulatory Development Authority and then National Drug Regulatory and Development Authority. Drug here refers to basically medicines or the pharmaceuticals. So some kind of regulatory authority should be there, which should take care of the administrative, financial and other required things. Then a roadmap for universal health coverage basically was developing in India after this recommendation of the high level expert group. So what kind of thing were basically happening here? Now 2010 onwards, but basically from 2010 to 2016 and 17, there were certain things which were happening, and we get to know about an evaluation of the things in a report which is known as Situation Analysis Backdrop to the National Health Policy 2017. When we had the National Health Policy 2017, then along with the policy document, it also published a report which was known as the Backdrop to the National Health Policy 2017, and here it has presented a kind of assessment or evaluation of the programs which were running there. Now, some of the important things which were mentioned in this report are relevant because that help us to understand what kind of things were happening in that specific time period. So 8 states introduced health insurance program for covering the tertiary care needs. Now 3 things are here. One, how many states? Answer is 8 states. Then what is it that we are talking about? We are talking about the health insurance programs and what kind of health services these were actually catering to. That is the most important question, right? And that is basically related to the tertiary care needs. So the primary health care needs are basically addressed at the primary health center level, and that is free of cost. So for that, basically, no insurance facility is required. Then the secondary services, these are also available at the district hospital level, right? And even in these cases, basically, the cost is not very high. So the insurance is actually not required very often for these type of services. But the tertiary care, that is basically done, or the services are basically available in the specialty hospitals, or the cost is basically much high in these contexts. So this 8 states introduced the health insurance programs to cover this tertiary healthcare needs. However, many of these states like Andhra Pradesh, Karnataka, Tamil Nadu and Maharashtra moved to direct purchasing of care through trusts, while reserving some services to be delivered only through public hospital. So, certain trusts were there, and very often the trusts are considered to be not for profit kind of agencies, right? That means the state government were following specific mechanisms, and some of those basically were directly purchasing the services from the private sector, and some of the states were purchasing the services through certain trusts. Those were the mechanisms. We need to have just a basic understanding of this. Then the central government had launched the Rashtriya Swasthya Bima Yojana in 2008. Basically, much before the high-level expert committee's report, in 2008 itself, the central government has launched this program, Rashtriya Swasthya Bima Yojana. The population coverage under these various schemes expanded from almost 55 million in 2003-4 to about 370 million in 2014, almost one-fourth of the population. Nearly two-thirds, 180 million of these population were those in the below poverty line category. That means the central government was already having the Rashtriya Swasthya Bima Yojana, and that was catering to the financial needs related to health insurance, right? And then that program was running successfully also, although it was having some problems as well, but overall that the program was running successfully. And some kind of evaluation studies have also been conducted, and in this document also some kind of evaluation and assessment is mentioned. Like, the evaluations show that schemes such as RSBY have improved utilization of hospital services, especially private sector, and among the poorest 20% of household and SC/ST household. However, there was low awareness among the beneficiaries about the entitlements and on how to use RSBY card. So there were issues basically. The Rashtriya Swasthya Bima Yojana was providing a kind of health card, but although people were making use of that, but how to make optimum use of that awareness was not there. And then there are reported cases of some sort of misuse of the RSBY card also. Another concern is related to denial of services by private hospital for many categories of illnesses and oversupply of some services. Now, there was lack of awareness, and because of that, sometimes the private hospitals were denying these services under certain categories, even if the persons were having the RSBY card. And there was oversupply of certain services also. That means there were certain specific medical services which were considered very convenient by some of the private service providers, and they were basically going for oversupply of those. On the other hand, certain services which were essential for the patients or the people, but those were actually denied. That means some kind of problem was existing in providing those services. There were issues related to governance and poor management. Insurance schemes vary widely in terms of benefit packages and have resulted in fragmentation of funds available for healthcare. especially selective allocation to secondary and tertiary care over primary care services. So there were several types of basically issues, and sometimes there was a mismatch between the allocations for the primary, secondary or tertiary care things, right? That means although the RSBY was there, it was covering a huge population, but the services were not delivered the way those were supposed to be or as per the mandate. Then came this National Health Policy 2017. We have already talked about it at length in one of the previous lecture. So although I have mentioned the content over here, but I will not talk about these things at length because our time will not allow us to talk about all those things. We will simply review the important points here, right? So this 2017 health policy talked about basically achieving the universal health coverage goals, and then there are three very important points here that I have mentioned here as A, B and C. So A is basically assuring availability of free comprehensive primary health care services, right? National Health Policy 2017 did talk about it, and basically it considered that the primary healthcare services should be the most important, most powerful tool to achieve the universal health coverage, right? Then it also talked about having a collaboration with the non-government sector on pro bono basis. That means the government first will try to get the services if these are available free of cost, or otherwise will go for services which are available at low prices, right? So these were basically related to this. Then second important point here is the ensuring improved access and affordability of quality secondary and tertiary care services. So the primary services readily available, free of cost, and then the secondary services, basically there should be secondary and tertiary services. So there are important component like there should be affordability of that, and then improved accessibility related to that, right? And the government basically here was playing as an important agency in matching or basically in developing some kind of link with the private providers also. And then the third point here is achieving a significant reduction in out-of-pocket expenditure, right? Because the primary purpose of universal health coverage is to reduce the out-of-pocket expenditure, and so this policy is talking about ways and means by which the out-of-pocket expenditure should get reduced. We have already seen basically the details related to the out-of-pocket expenditure in some of the previous lectures also. So what were the specific recommendations of the policy, or the specific directions or the guidelines of the National Health Policy 2017 to achieve the universal health coverage targets, right? So some of these are mentioned here. First is basically related to the primary health care and other things that we discussed. Another important component is basically to strengthen the health system performance basically. So some kind of health system is available in India that was existing. Now the effort was to strengthen that. Basically we have talked about the National Health Mission. Before that, the National Rural Health Mission and Urban Health Mission. So those health missions were primarily intending to strengthen the health system, right? So now we are having the strengthened health system. So how to make an optimum use of that to achieve the coverage requirements, that is one of the important goal, and it talked about those important things also. For example, it mentioned that the antenatal care coverage to be sustained above 90% and skill attendance at birth above 90% by 2025, or more than 90% of the newborn are fully immunized by 1 year of age by 2025, right? Or meet the need of family planning above 90% at national and subnational level by 2025. So these were related to the health system performance, and of course they are all talking about the coverage of the health services or the universal health coverage. Then it also talked about the immunization program. We are already aware of the universal immunization program, and we have discussed the things at length earlier also. So we are putting the things at the right context only, and that is why we are talking about these things. And then to expand public provisioning of tertiary services, Yes, of course, that is also very important component, because the tertiary healthcare services are the most important, because those are serious and there is question related to life and death involved in that. So those are basically very important. Coverage in terms of population and service will expand gradually in the tertiary services also. It was actually mentioned or directed. Then we come to very important component of our lecture, and this is basically what kind of new programs or initiatives basically have been made, right? So there are three important things here. One is very important in the format of the Ayushman Bharat, a flagship scheme of Government of India that was launched uh, after the National Health Policy 2017, and the goal is to achieve the vision of universal health coverage, right? So very often we relate the Ayushman Bharat program with the goal of universal health coverage, because of course Ayushman Bharat is talking about multiple things, but all those things are actually directly related with the goals of universal health coverage also. Ayushman Bharat is an attempt to move from sectoral and segmented approach of health service delivery to a comprehensive need-based healthcare service. So that is a strategic position, that what kind of services will be provided over here and how that will be managed, right? So that kind of thing. There were three very important things under this Ayushman Bharat scheme, and two important things basically that we can talk about, or that we need to talk about, are the coming into existence of the Health and Wellness Center and the Pradhan Mantri Jan Arogya Yojana. So what are these health and wellness centers? In February 2018, the Government of India announced the creation of 150,000 health and wellness centers by transforming the existing sub-centers and primary health centers. These centers are to deliver comprehensive primary health care. So initially, the sub-centers and the primary health centers were constituted, and we have been talking about that since very first few lectures also, right? We talked about the primary health centers when we were talking about the recommendations made by the Bhore committee. Then we talked about the primary health centers when we were talking about the Alma Ata declaration. Then we also talked about it by when that was mentioned by the Astana declaration also. So now what is happening, that initially the primary health centers that we were having were not very effectively translating the goals of primary health care, because the concept of primary health care is expanding, and as of now that is very strengthened. It talks about multiple type of facilities and provisions. It is not talking about only the medical care component. It also talks about good number of social determinants and other factors, right? So it is stated that the health and wellness centers will come into existence after converting the existing sub-centers and primary health centers, and then these health and wellness center will operate to achieve the goals of comprehensive primary healthcare, and that comprehensive primary healthcare basically will include all latest guidelines for the primary health, right? So this is one very important intervention at this level. The second is the Pradhan Mantri Jan Arogya Yojana. So earlier we talked about the Rashtriya Swasthya Bima Yojana, RSBY. Now this RSBY basically program got somehow transformed into Pradhan Mantri Jan Arogya Yojana. Let me speak a few sentences from the slide. Ayushman Bharat PMJAY is the largest health assurance scheme in the world, which aims at providing a health cover of Rs 5 lakh per family per year for secondary and tertiary care hospitalization to over 10.74 crore poor and vulnerable families, approximately 50 crore beneficiary that form the bottom 40% of the Indian population. That means it's a very huge program. It is intending to address the bottom 40% of Indian population, those who need it the most, and it talks about providing a health coverage of Rs 5 lakh per family per year. That means all the problems related to out of pocket expenditure or high cost of medical care that we have been talking about are supposed to be addressed by the launch of this Pradhan Mantri Jan Arogya Yojana. This PMJ was earlier known as the National Health Protection Scheme, NHPS, or the Rashtriya Swasthya Bima Yojana, and this is basically an improved version of this, along with the change of the name, and certain new provisions have also been added over here. But this is helping us to understand that there is a kind of continuity in the health programs and interventions. Also, there is a kind of incremental change, so new improvements are basically added, but a continuity is also maintained. Then if you want to understand the modality of the Ayushman Bharat, then we can see that there are important provisions like the assurance model or trust model is there, then the insurance model is also there, and the mixed model is also there. Basically, this Ayushman Bharat program talks about multiple modality depending upon the choices of the various states and of course the central government to execute which kind of program or which kind of combination basically is being executed. Because earlier in this lecture we were also talking about the RSBY and the kind of modalities which were available. So what are the achievements in the direction of universal health coverage in India till now? If I want to ask this question, then what could be your answer? Because we have been talking about so many health initiatives till now, and basically we have also been talking about the specific social categories, like we were talking about women, children, then persons with disability, elderly, right? So what are the overall achievements that we can count as of now? If I ask this question, then I have tried to answer this question by including all the points that we have discussed so far in all the previous lectures also. One very important thing is this, the RMN CHA plus N strategy, right? You may remember we talked about the reproductive, maternal, neonatal, child health, adolescent plus nutrition strategy, and that is basically the continuum of care kind of a strategy which talks about the women and health of women at every stage, right? Then we also talked about the National Health Mission and the way it has strengthened the health structure in India, started from NRHM, that is National Rural Health Mission, and then in 2013 it also included the National Urban Health Mission, so that the issues related to urban poor and people who are living in the slum should get addressed. And then basically we had this National Health Mission as the umbrella to include both. Then we also talked about the facility-based integrated management of neonatal and childhood illnesses, right? Because there were certain specific requirements related to the healthcare needs of the neonatal. Then we talked about the universal immunization program. Now that is also identified as the Mission Indradhanush, right? So Mission Indradhanush is talking about providing all necessary vaccines and immunization to the children, right? So this is a very important health coverage program. Basically, coverage through immunization is a very important, very necessary. And then there are basically mobile medical units and telemedicine also operating under the NHM. Then we also talked about the Ayushman Bharat program and Health and Wellness Center and the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So all these programs are basically trying to address the issues related to universal health coverage, right? And in some of the previous lectures, basically when we were talking about the health of the women, then we talked about some of the specific programs like Janani Suraksha Yojana, then Janani Shishu Suraksha Yojana, then Rashtriya Kishore Swasthya Karyakram, then Pradhan Mantri Surakshit Matritva Abhiyan, then Mother's Absolute Affection, basically initiating the breastfeeding to the newborn, right? And family planning and other programs. That means several programs got initiated in last few decades, right? Under the banner of universal health coverage and even before that, right? So all these programs are helping in achieving the goal related to universal health coverage. Now, before we close, I would like to provide you some statistics here also that is related to the health and wellness center. As we stated that the sub centers and primary health centers were supposed to get converted into the Ayushman Bharat Health and Wellness Center, and that will provide the comprehensive primary health care. So, what are the statistics here? According to a press release by Ministry of Health and Family Welfare on 21st of March 2021, the target of operationalizing 70,000 Ayushman Bharat Health and Wellness Centers achieved ahead of time. That means already having more than 70,000 the health and wellness centers, and then about 41.35 crore people have accessed the primary healthcare services at these centers, and then more than 9.5 lakh teleconsultation done at the health and wellness centers. That means India has achieved several things in the direction of achieving the goals of universal health coverage. And then there are good number of basically disease control programs which are operating. Then the universal immunization program are including new vaccines. Then several new techniques and tools are basically adopted in most of the healthcare related things. So with this, we can conclude this lecture that although the target of reducing the out-of-pocket expenditure is being achieved gradually, although there is not a very high or very satisfactory reduction in that, but we can say that the process has started, as was evident in two lectures that we had for this week's program. And then the coverage in terms of the facilities or health delivery system has increased, and that is also increasing. So with this understanding, we can close the discussion of this lecture as well as of this week. And thank you very much for being with me. In the next week, we will discuss some of the important things which are very important, and the course will come to the last week or the final week next week, right? So we will try to address all remaining topics, which are not only just the remaining topics, but also the most important topic, because those will help us to understand the meta narratives that we have developed till now. So thank you very much for being with me. We will meet in the next class. Take care.